Hi, my name is Kareem Helbaoui. My capstone project is using Six Sigma to reduce patient wait time in outpatient clinics. The presentation will be broken down into sections listed that I've used to write my paper. Throughout the years, healthcare has been evolving with breakthroughs in modern medicine and continuous improvement in medical equipment. With more efficient equipment, medical facilities such as hospitals or clinics are seeing more patients and generating more revenue. Since medical facilities are providing a service, they need to be customer-oriented and make sure they cater to their customer needs, who are their patients, to help improve their revenue. For medical facilities to know if they're providing a good service, they need to determine if their patients are satisfied. Having satisfied patients means that the hospital or clinics are providing a good quality of care. For medical facilities to know if patients are satisfied, they can look for factors that make patients happy. Some factors are low waiting time to see the doctor, if medical staff has great customer service, and if doctors are providing a great quality of care to patients. Medical facilities should measure each factor and see if their patients are satisfied. My paper focused on the waiting time factor and how Six Sigma can reduce waiting time to improve patient satisfaction. To briefly explain, Six Sigma is a process-oriented tool that is used to measure processes quantitatively. It usually measures how many defects are within the process. A process that has achieved Six Sigma means that there are only 3.4 defects per million opportunities. As shown in the table, as sigma levels increases, the number of defects decreases, and the process is more efficient. Six Sigma methodology is used to tighten and continuously monitor the process. The methodology is broken down into 5 phases, which are define, measure, analyze, improve, and control. In the define phase, the overall problem and objectives are defined. It helps to define all stakeholders to help identify the overall problem. Also, a process map is used to visualize the entire process that would help find any non-value-added activities that may cause waiting time. The measure phase is where data is measured and collected. In the analyze phase, statistical tools are used to analyze the data that was collected in the measure phase. Also, a cause and effect diagram is used to find root causes of the problem. In the improve phase, a process is modified by adding solutions to the root causes of the problem to improve the process from variation. After, the data is recollected and analyzed to verify that the process has improved. In the final phase, the process is continuously monitored to ensure that the improvements are sustained over time and the process is in control and free from variation. Six Sigma has had a lot of success in the manufacturing industry. However, it hasn't been widely used in healthcare. One of the reasons is that the processes in healthcare are complex compared to manufacturing process. It is hard to quantitatively measure a service compared to a product. Also, the processes in healthcare contain a lot of noise, so it's hard to collect accurate data. Measuring patient satisfaction is not easy since each person has his own view of what it takes for the patient to be satisfied. In addition, it may be hard to determine what a defect is in healthcare since a defect may range from a waste of time to patient's death. Another reason why Six Sigma isn't as successful is that staff working in healthcare aren't comfortable with statistical tools. This may be the case since staff members aren't usually familiar with statistics. Because of this, they won't easily accept the methodology or stop using it after a while. Even if the staff is trained to use Six Sigma, if there isn't a collective motivation to achieve Six Sigma results, then they won't achieve it. Even though there have been some difficulties implementing Six Sigma in healthcare, there has been noticeable improvements when using Six Sigma. Six Sigma helps create a shared accountability for healthcare staff for continuous improvement. Furthermore, it helps give the staff works more meaning and importance as they are helping improve quality of patient care. As a result, Six Sigma has had success in increasing patient satisfaction while maintaining excellent service levels at a low cost and effectively using available resources. The patient wait time not only is a direct factor that affects patient satisfaction, but also is an indicator of the healthcare quality of patient services. As the waiting time increases, the patient satisfaction decreases significantly. In a case study, it was found that it is acceptable for patients to wait up to 20 minutes to see a doctor in a clinic. However, anything more than that drastically reduces patient satisfaction. Also, patients who wait more than 20 minutes were more likely to complain about the clinic and not recommend going again. On the other hand, patients who wait less than 20 minutes highly recommend going to the clinic. The figure shows that the average satisfaction score of patients versus the waiting time at clinics. After 20 minutes of waiting in the waiting room, patient satisfaction goes below 4.5, which may result in patients not returning or not recommend going to the clinic again. Because of this, clinics should try to reduce waiting time for patients in the waiting room to be at most 20 minutes. FIDOS, an online healthcare database, collected the average waiting time per state across the U.S. for 2015. The national average was collected to be around 19 minutes with a standard deviation close to 2 minutes. As shown in the figure below, there are 14 states with an average waiting time of more than 20 minutes, which is unacceptable for patients. This proves that there is still need for improvements in clinics around the country. Also, there's a problem developing in countries where there aren't enough doctors to meet the demand of patients. This is typically occurring in developing countries. The problem of not having enough doctors results in patients waiting a long time to see a doctor or a specialist, since the doctor can only see a certain number of patients per day. Some countries have patients waiting more than 9 weeks to see the doctor, which is unacceptable and puts the patient's life at risk if there's a serious problem. The Northern Ireland Council of Voluntary Action collected data of waiting time for outpatients waiting to see a doctor in Northern Ireland for the past several years. The figure shows different time bands of patients waiting. From the figure, it can be observed that the number of patients waiting more than 9 weeks and more than 18 weeks has increased rapidly since March 2014. This links to an increase in total number of outpatients in that area during that time span. This can indicate that there aren't enough doctors to meet the increasing demand of patients in Northern Ireland. Because of this, clinics in those areas need to find ways to improve the patient processes to reduce the waiting time to help to fix this problem. Six Sigma is successful in process-oriented applications. Since patients going to see a doctor has a process and data can be collected on waiting time, there's no reason why Six Sigma won't work. However, for it to succeed, the patient process must be first broken down and simplified. The first phase of the define, helps look at the entire process and determine the scope and objective. To define the process, the stakeholders involved in this process must be identified. Looking at a hospital or clinic, the internal stakeholders are doctors, nurses, patients, and other staff. As expected, the patients are the primary stakeholder in this case. A process map is crucial to the Six Sigma project as it helps pinpoint areas that may be causing waiting time for patients. Each hospital or clinic has its own unique process and would be mapped out differently. Generally, the process map would follow such processes as shown in the figure. To get a comprehensive and unbiased process flow map, it is better to have different stakeholders, such as doctors or nurses, give their own view of the process. The process map shows the patient flow through a clinic. The patient map caters to two types of patients, the patients with appointments and walk-in patients. Once the patient enters the clinic, they register at the counter and wait at the waiting room. When the patient is called in, he or she enters the consultation room and begins their first consultation. If the doctor doesn't require lab tests, such as blood tests or radiology tests, the patient ends their visit after paying at the payment desk. However, if the doctor needs extra lab tests, the patient would need to go to a specific department to conduct the test. The patient would enter a new queue system. Following the test, the patient would return to the clinic and wait to see the doctor for a second consultation. After that, the patient pays for the visit and tests and leaves the clinic. A case study by E.V. Gijo et al. Looked at reducing waiting time in the pathology department of a hospital using Six Sigma. The pathology department is responsible for conducting different types of tests prescribed by the doctors within the hospital. The reports created from the pathology department are crucial for proper diagnosis. So for patients to get faster diagnosis, the pathology reports need to be delivered quickly. The case study broke down the pathology department's sample collection process using Six Sigma methodology. For the defined phase, their goal was to reduce the patient wait time for sample collection to be less than 20 minutes. For the measure phase, the average waiting time for the patients was found to be 24 minutes, with a standard deviation around 18 minutes. For the analyze phase, the team needed to identify the root causes of waiting time problem, such as non-value added activities. This is done by using a cause and effect diagram shown in the figure. After the team validated the causes from the cause and effect diagram, the root causes of the problem were identified. The causes were variation between technicians and trainees for sample collection, less manpower on Mondays and just after holidays, materials for sample collection weren't available, and more patients coming in on Mondays and after the holidays compared to other days. After finding the root causes for waiting time, the team needed to find solutions for the causes and implement them for the improve phase. To solve the issue with less manpower and higher volume after Mondays and holidays, Management decided to shift around technicians' weekly and holiday schedule to meet demands. To solve the materials issue, a materials checklist was prepared so that staff had to check the materials availability the previous evening. To solve the variation for sample collection between technicians and trainees, trainees were only allowed to collect samples after 11:30 a.m. after peak times. After implementing these solutions, the average wait time for sample collection was reduced to 11 minutes with a standard deviation of around 10 minutes. The signal level was reduced to around 4 from 91, which is a huge improvement. A dot plot was used to show how much the waiting time improved after implementation and is shown in the figure below. A case study by Jackson and Walsh looked at reducing patient wait time in a phlebotomy department within the hospital. A phlebotomy department is where patients go to draw blood for testing. The department collects on average 230 specimens every day. The process for patients arriving at a phlebotomy lab starts when they are sent to the department from a nurse within the hospital for collection. The patient would arrive and check in with the nurse. Then they would wait in the waiting room for their name to be called by the phlebotomist, and then get their specimen drawn and would leave. This process was looked at using Six Sigma methodology. In the measure phase, the wait time fluctuated. It was high in the morning where it was busiest and declined during the day. Some patients were waiting up to 30 minutes during peak times. For the analyze phase, causes for the wait time were found. The staff had to walk around a third of a mile in the hospital with the specimen to the laboratory. In addition, the staff would sometimes walk around the hospital during peak times, picking up samples from other doctors. Also, the department wasn't using their resources efficiently, as their workstations weren't always filled during peak times. For the improve phase, solutions for the root cause were found. The staff started to use a tube system within the hospital to send the specimen to the lab at a much faster rate. Also, the staff were no longer picking up specimens for doctors during peak times. In addition, staff scheduling were rearranged to handle the peak times in the morning. After implementing these changes, the department noticed a reduction in average waiting time for patients, and waiting time was consistent. The waiting time after the study was 15 minutes or less for sample collection. Also, the staff felt less overwhelmed during peak times in the morning. The difference in waiting time before and after the study is shown in the figure. From the two case studies, it was established that not only is Six Sigma implementation possible in the clinical setting, but also it proved to help reduce patient wait time. As a result, the patient satisfaction improved. It is important to note that the results for both case studies were achieved with only the available resources and without any extra investment, except for training. However, the biggest challenge was to train the medical staff in Six Sigma methodology. This was because they weren't exposed to statistical tools, so there was a real challenge for them to understand and accept them. After they had been convinced and accepted the methodology, the employees were more involved with the process improvement initiatives. This helped establish a quality and culture throughout the hospital and helped generate more ideas for ways to improve. Generally, there are different factors that may cause waiting time to occur within a clinic. Each clinic has their own set of factors that results in waiting time. However, there tends to be a lot of factors in common since the patient processes are somewhat similar from one clinic to another. The first factor is the staff weekly scheduling. If there's an increase in volume in patients arriving and there isn't enough staff available to accommodate these patients, then it results in waiting time. Another factor is not having enough doctors to meet the demand of patients. This is especially true for developing countries when there aren't enough doctors, like in Northern Ireland's example. Another factor is patient scheduling, such as appointments. Since the clinic have certain working hours, then they have a certain number of people they can see per day. When a patient who has an appointment arrives late, this results in the clinic becoming more congested and the patient's schedules afterwards have to wait longer to see the doctor. A regular patient calling sequence is a factor as well. This happens when the staff calls in a patient out of order. This happens if a patient comes in early or is out of the clinic when the patient's name is called. Registration and checking in are also factors. New patients who enter the clinic would need to be registered. Registered would include the patient's information and insurance details, and filling out all these forms would take some time, especially if the forms are long. Checking in may increase waiting time if there aren't enough staff at the counter during peak times. The last common factor is unused session time. Unused session time is the time wasted in the consultation room when they could be used to see another patient. This can be caused by not having the appropriate material in the consultation room, such as syringes or cotton swabs, the time doctor takes to fill out the reports, or waiting for the lab results. These are the common main factors that can cause waiting time for the clinic. They usually account for 80% of the total waiting time. If the clinic can manage to remove or improve these factors, they can expect to have a more efficient process that will improve the patient satisfaction. My recommendations are for the problems that can be reasonably solved for the clinics. Fixing the problem of not having enough doctors isn't complex. The only solution is to somehow get more doctors to move to that area. For registration and appointment scheduling, clinics can make the process more efficient and convenient by creating a website or mobile app that allows the patient to book in advance. For registration, new patients can fill out the information and insurance online before coming to the clinic. This allows patients to make sure that their insurance is pre-approved before going and saves them time. To fix the patient scheduling and patient calling sequence, staff must be more organized and more aware with the patients in the clinic. New patients are generally given a larger block of time to see a doctor compared to repeat patients. To avoid calling patients out of order, the clinic could display the name or number on the screen in the waiting room that shows the order or who's next. This allows patients to know how long they have left to wait. An additional feature to the online website or app mentioned above is where the patient writes a brief explanation of what's going on with themselves, such as symptoms, to help the staff determine which doctor to send the patient to. This avoids sending the patient to the wrong specialty and reduces waiting time for patients. Another thing that clinics can do is to digitalize patient medical records so all clinics or hospitals have access to in a certain country. Not only would this reduce the time that the doctor takes to ask patients questions about themselves, but also it helps the doctor correctly diagnose the patient due to more information available, which would improve the quality of care the patient is receiving. A way to keep the patient satisfaction up in a waiting room is for the clinic to keep the patients entertained while waiting. A lot of clinics usually have magazines or television in the waiting room to help reduce patient boredom. However, some patients may not be interested in those options. It is better to have the patients engage in useful activities, such as giving healthcare education on important health issues. It may help save the doctor time to help explain information to the patients and use that time to see more patients, causing a reduction in waiting time. In conclusion, waiting time has a huge impact on patient satisfaction, which in turn is an indicator of the level of quality of care the patients are receiving. Having a long waiting time indicates there are inefficient processes and insufficient staff and/or resources being used to handle the patient load in the clinic. Using Six Sigma not only reduces patient wait time, but also improves the patient processes within the clinic by reducing non-value-added activities that may be increasing the waiting time. From the two case studies presented, two departments and clinics successfully implemented Six Sigma and achieved great results by having their average wait time be reduced and increasing their patient satisfaction. In addition, the use of Six Sigma helped reduce the stress of the clinics and feeling overwhelmed during patient peak times. This helped the staff and doctors perform better, reduce the risk of making a mistake in diagnosing the patient, and providing a higher quality care for them. Thank you all for taking the time to watch my presentation. If there's any questions, please feel free to email me at the email below. Thank you.